Here are my top 10 tips for improving knee pain arising from cycling. Number 1, get your saddle position correct. When the crank is at bottom dead center, pointing straight down, the knee angle that you're looking for is somewhere between 35 to 40 degrees. If your saddle is too low and the knee angle is greater than that, there's going to be increased forces on the patellofemoral joint at the front of the knee. If the saddle is too high, that's going to increase the stretch on the hamstring muscles. It's going to change the way that your ankle is moving, and it's going to upset your pelvic stability on the saddle. You need to make sure that your fore-aft positioning is correct as well. Generally, when the crank is at the horizontal forward position, we want to see the kneecap is pretty much directly in line with the spindle of the pedal. We also need to consider the saddle tilt. Generally, we're looking for somewhere between 0 to 2 degrees of downward tilt of the nose of the saddle. If you are tilted down more than that, then the tendency is for your body to slide forwards. That means your leg muscles have to push harder to keep you where you are in your saddle, and that's also going to load the patellofemoral joints more. Number 2 is cycle using cleats. When you use cleats, you can pull up on the pedal stroke as well as push down. That means that your dorsiflexors, your hip flexors and your hamstring muscles can contribute power to the pedal stroke, as well as the glutes, the quadriceps and the calves. This will help to balance power delivery through the pedal stroke and will also help to balance the muscular development of your leg. Number 3 is to make sure that your cleat position matches your preferred foot stance position. If you tend to be an out-toer, or you have a neutral foot stance, or if you're pigeon-toed, then your cleat position will need to match that to a degree. However, be careful setting too much out-toeing on your cleat, because that can cause the heel of your shoe to rub against the chainstay. Number 4 is to strengthen your quadriceps and gluteal muscles, as this is proven to help with the main types of cycling knee injuries, which are patellofemoral pain and patellar tendon pain. The 3 exercises that I would suggest, number 1 are squats, either double leg or single leg. Number 2 would be bridging, either double leg or single leg. And number 3 would be wide base, sumo walks forwards with a band around your ankles or around the balls of your feet. Number 5, aim for a vertical knee action when looking from front on. To check this, set your indoor trainer up either in front of a mirror or have a video camera record you and watch back later, and have a look to see if your knee action is close to vertical or is there a fair degree of out to in motion as well, which is associated with patellofemoral pain. Number 6 is to respect the acute-chronic ratio of training intensity. In summary, this means that if you increase your training load intensity by more than about 10% per week, then you have an increased likelihood of injury. So we're trying to avoid any sudden spikes in training intensity or volume. And if you have a prolonged period of time away from training, then you need to make sure that you are slowly increasing back to your normal levels over the course of several weeks or maybe even several months. Number 7 is to warm up before and cool down after each ride. Now, this does not have to add a lot of time to your routine, but simply a few minutes of soft to moderate pedaling at the start of the ride and a few minutes of soft to moderate pedaling at the end of the ride will help your knees and your body in general accommodate to the new level of activity. Number 8 is to stretch tight muscles to allow for optimal pedaling technique and to prevent unwanted biomechanical adaptations. Typically, I'd suggest that you should be stretching your hip flexors, your iliotibial band, your calves, your quadriceps, and your hamstrings. Number 9 is to choose the right gearing. Generally, for most people, the optimal pedaling cadence is going to be somewhere between 70 and 90 RPM. That's where your pedaling is going to be most efficient and most powerful. If you are pedaling hard and you're riding at 60 RPM or lower, then you are grinding and you're going to increase the forces on your knee joint. If you're riding hard and you are sitting at well above 100 RPM, then you're overspinning and you are challenging the stability system. And number 10, change your cycling posture regularly. Spend some time out of the saddle to alter the load on your knees, your other muscles and joints, and to give your sit bones a breather. So in summary, these 10 simple strategies to ensure the correct positioning of your saddle and your cleats, to prevent any training errors and to ensure optimal recovery techniques will improve your cycling comfort and performance.